right. I have checked the provider's order. I have checked the facility procedures. I have gathered all my supplies. I'm gonna knock on the door, my patient's door. I'm gonna perform hand hygiene. I'm gonna introduce myself. My name is Keosha. Today I'm your student nurse. I'm gonna provide privacy, wash my hands. All right, can you please verify your name and date of birth? All right. Are you experiencing any pain today? With 0 being no pain, 10 being the worst pain you ever experienced in your life? Okay. All right, I'm gonna raise your bed. Do you have any allergies that I need to be aware of? Okay, great. I'm gonna raise the bed to waist height, and I'm gonna also lock the bed. Okay, so today I will be performing a Foley catheter. It should release some pressure if you have any on your bladder. I'm gonna put my gloves on, and I'm gonna perform perineal care on my client. Okay, I'm gonna take my gloves off. I'm gonna wash my hands. I'm gonna go ahead and take the Foley catheter out. I'm gonna also make sure that it is not expired. I don't see any leaks or splits in there in the bag. Okay. I'm gonna look at my sterile gloves. I'm gonna check the expiration date. I'm gonna make sure that I don't see any rips or tears in my sterile gloves. And I'm gonna go ahead and open up my Foley catheter. Okay. I'm gonna go ahead and open up my sterile gloves. Trash. Okay. So now I'm going to toss this. I'm gonna fold it like this, making sure it doesn't touch. I'm gonna put it under my patient. I'm gonna open up my swab. I'm gonna toss this. I'm gonna put the jelly on my catheter. I'm gonna toss. I'm gonna put my syringe. And toss. I'm gonna clean from the tip. And if it's uncircumcised, I will pull the skin back. Two. Three. All right. I'm going to insert my catheter. All right, on the count of 3, if you don't mind taking a deep breath for me. 1, 2, 3. Insert. I see a flash of urine. I'm going to insert 2 more inches. I'm going to hold to make sure it's secured. I'm going to inflate the balloon 10 cc's. And once I insert it, I'm going to go ahead and take the syringe out so I won't get any resist the pressure pullback. All right, and I'm going to tug on it and check for any resistance. Then I'm going to go ahead and clean up. Take my gloves off. Wash my hands. I'm going to go ahead and put the stat lock on. Make sure it's in my patient's inner thigh. Make sure I don't see any looping. Make sure I don't see any looping. I'm going to also, if it has a bed sheet, I'm going to put it on the bed sheet, and I'm going to hang the bag on the non-movable part of the bed. And I'm going to make sure it's below the bladder and it's not touching the floor. I'm going to put my initials, name and time on the stat lock. I'm going to put my bed rails up. I'm going to lower the bed, put the call light, give the call light to the patient and assess them and ask them how they're feeling. Are they feeling okay? Is everything okay? And I'm going to go ahead and ask them if they want immediately the door open or close. Then I'm going to go ahead and see that I have an order for the provider needs me to remove the Foley. So I'm going to go ahead and wash my hands. I already checked the provider's order and facilities, procedures. I'm going to make sure I have the right patient by asking them, can they please give me their name and date of birth? I'm going to introduce myself, let them know I'm Keosha. I'm the student nurse here to remove their Foley catheter. I'm gonna ask them about their allergies. I'm gonna ask them if they're experiencing any pain. And then I'm gonna also wash my hands and put my gloves on. All right, I'm gonna raise the bed to waist height. Put the rails down. Make sure the bed is locked. Have my syringe. All right, I'm gonna go ahead and look at the bag. I'm gonna check and see, look at the urine color. I'm gonna check and see if it's cloudy, clear. When I drain it, see if it has any smells to it, any foul odors, any blood in the urine. I'm gonna notate that the output was 250 cc's. I'm gonna go ahead and empty that out. I'm gonna go ahead and get my biohazard bag, put it on the bed where my patient is. I'm gonna go ahead and empty it. I'm gonna go ahead and put the bag right here where my biohazard bag is. And I'm gonna go ahead and let the patient know on the count of 3. I'm gonna take a deep breath in. Okay, 1, 2, 3, deep breath. All right, I'm gonna go ahead and deflate the balloon. And once I do that, I'm gonna take it off, trash. I'm gonna go ahead and take the catheter out. And I'm gonna gather and put everything in a biohazard bag. I'm gonna take it off, put a linen back, lower the bed, ask my patient how they're feeling, do they need anything? Lower, make sure the bed is lower. They have a call light, the rails are up, the bed is locked. And assess their pain and go ahead and document how much the output was, the color, the smell, and did I see any blood, and my patient assessment. And yeah, ask them do they want the door open or closed. And that's it.